Radhe Radhe and Namaste. Welcome to our JKYog Academy online health webinar. Today we have Dr. Charu Gupta ji. She's going to talk about congestive heart failure. The glass is half full. So Dr. Charu Gupta, she grew up in Midland, Texas. She graduated from Stanford University and she participated in some health screening at various temples, gurudwaras, and mosques for the South Asian community. She has also advanced failure mechanical circulatory support and transplant cardiologist. She also went to school at UT Southwestern, Emory Vanderbilt, and UC San Francisco for her training. And she's currently working in Chicago at the North Shore University Health System. And I also want to thank Dr. Cardiology for bringing us, the doctors, and JKYog together so we can have the health webinar series. So let me pass over to Dr. Charuji. Over to you, Dr. Charuji.
Okay, thank you. I'll share my screen in just a minute. So as she mentioned, I'm Charu Gupta. I have been interested in heart failure since I was in medical school and continue to love working with all of the heart patients, many of whom are South Asian. And we find so many people who don't realize that there's a much higher rate of heart disease in South Asian patients. So it's really important for us to educate everyone and for educating ourselves so that we can advocate on our own behalf. So let me... Okay, congestive heart failure, the glass is half full. Even the term congestive heart failure, I think a lot of people get very upset and anxious when they hear failure. I have some patients who have even asked me, can't you refer to it by something else? Like, this is very depressing whenever I hear this term. Unfortunately, this is the name, or we can say CHF. Everything is not lost. It is not the end of anything. There are still a lot of different things that you can do to feel better and to get better and to continue a very meaningful life, and that's filled still with purpose and loved ones and still being active, but it does take some effort. So heart failure is a major problem in the United States, in India, and all over the globe. It's a huge driver of morbidity and mortality. In the United States alone, more than 6.2 million adults have heart failure, a huge cost, and more than 13 to 15% of death certificates at least will mention heart failure. The biggest problem that we run into is that people don't realize that heart failure is such a big problem, and that ultimately it can cause quite a few people to pass away or contribute to their death. So we talk about cancer a lot in the media, but you know, heart failure has a very aggressive course. It can be very similar to leukemia, lung cancer, pancreatic cancer, and other diseases that we're more used to hearing about. Sorry. So why does somebody develop congestive heart failure? There's so many different aspects of our bodies, including aging, that all combine to help somebody develop different types of heart failure. So high blood pressure, which is a huge problem within the South Asian community. And I'll talk a little bit more about that later. Other heart problems, including valve defects, you know, especially in developing countries, we see issues like rheumatic fever, people had scarlet fever, and disease of their heart valves. There can be heart and muscle defects that are passed down between people in a family. And then a major one, and I think one of the biggest ones, especially for South Asians, is coronary heart disease. So clogging of the arteries of the heart, which actually leads to either a weaker heart or a very stiff heart. And all of these lead to this very general umbrella term of heart failure. We also have a lot of diabetes, obesity, sleep apnea, issues in the South Asian community, as well as diets full of too much salt, too much fat, too much carbohydrates, and sometimes a lack of exercise. So all of these different things can combine to heart failure. Sometimes we joke around that, heart failure is just the end result of almost any medical problem. So even just aging in and of itself can contribute to developing heart failure later in life, as well as female gender for certain types of heart failure and male gender for the remainder. So a lot of people will ask me, I have heart failure, am I going to have a heart attack? And these are two separate problems, but they can be very related as well, and they do have a lot of overlap. When you think about heart attack, you think about the people who have chest pain, nausea, vomiting, they might feel tired. When they're trying to walk, they feel kind of a pressure in their chest, or that very typical symptom of there's like an elephant on my chest. For women, the symptoms are a little bit more atypical. Sometimes it's just nausea. Sometimes it's just not feeling very good. It can be much harder to diagnose heart attacks in women, but you can have some, trouble breathing, lightheadedness, or what might feel like dyspepsia. Some people think I take 1 or 2 Tums and it'll go away. That's all it is. It's just an upset stomach, but that can actually be referring to a heart attack. Heart failure, on the other hand, isn't one event. It's something that develops over time, and it has waves of being worse and getting better. You go through phases of heart failure, and it's never really gone away. It comes and goes over time. So what people notice with heart failure is more of a shortness of breath. They might feel some lightheadedness. They might feel that their heart is pounding very hard. That they almost feel like they're nervous. Laying down to go to sleep, you might notice that they're very short of breath and they need to use more pillows. Some people will even be sleeping in a recliner so that they can keep their head straight up. And that feels better, although they're not quite sure why that feels better. Additionally, swelling of your belly or swelling of the legs. Many people will notice that their belts, they have to keep loosening their belt or getting bigger pants because just the belly is swelling. So heart failure is very different from the heart attack. Additional heart attacks can make your heart failure worse, but it's a different set of problems. Heart attack, it's, immediately you must get care, and how well you do depends on getting care as soon as possible. Heart failure is going to be something that you can kind of manage and will get better and worse. So it's a little bit more medical term, but I think it's important to recognize there's 2 different kinds of heart failure, and they affect different people for different reasons. One is called systolic heart failure, and this is the one that I think most people know more about. And basically, it means that you have a weak heart. It can't pump. It's a weak pumping mechanism. So, this image over here shows you that the heart kind of grows. It gets baggy and large, and it just can't function. It can't push the blood forward. Diastolic heart failure is more of a stiffness of the heart. I almost think of it as kind of a rheumatic issue or kind of an aging issue related to the muscle of the heart, where the muscle is very stiff. So you can imagine that as the thickness of the wall of the heart gets thicker and thicker, there's not enough room to let the blood in, and you can't push blood forward. So both of these 2 different problems end up with the same symptoms, essentially. Sometimes I use this schematic with patients. I'll just kind of draw a stick figure and say, we don't think about how the heart and the lungs are related to the body. And it's really just, I almost think of it as kind of a hose or a system that you're trying to, water the garden with. So you start with the body, and all the deoxygenated blood is coming from one side. It goes to the right side of the heart. It pumps to the lungs. You get all the oxygen in the lungs. Then it goes to the left side of the heart and to the rest of the body. So you can imagine if the left side of the heart is not functioning well, and if you kind of like bending a hose, all the pressure builds up behind it. And in this case, that means that the pressure builds up in the lungs. And that's why people get very short of breath. And that's kind of why explains the symptoms that people start to have. So the systolic heart failure or weak heart, when you have especially coronary disease or you've had multiple heart attacks, your heart starts to get scarred and enlarges and gets very weak. And you can see that this side, the left side of the heart here, is much larger. And the fluid is pushed backwards because it can't go forward. And the diastolic heart failure or stiff heart, you've got a very small cavity. And just like having a thick lining on the inside of this cavity, you can't get as much water into it or as much blood into it, and therefore it can't go forward. So it all goes back to the lungs. Additionally, when the pressure builds up in the lungs, it can go to the right side of the heart, and then you can actually get swelling in the belly, in the kidneys, in the liver, and in the legs. And that's kind of how all these symptoms start to go together. So some of the symptoms that we mentioned a little bit earlier, and these can be very mild or minor, or they can be very, very severe. So some people, when I first meet them, will tell me that they've been treated for pneumonia 3 or 4 times because they've been having a cough and shortness of breath before they find out that it's actually a heart problem that they're experiencing. So fatigue or lightheadedness, some shortness of breath, coughing, wheezing, although we usually think of it as more related to lung issues, can be related to cardiac issues. Heart pounding, fluttering, or a high heart rate, nausea, lack of appetite, and swelling in your legs are all things that happen. And in some of the later stages, we actually see that people get a little bit confused. They might not be able to think clearly. There can be a little bit of a brain fog. And when you ask their families, has something seemed different? Other people will be able to say, they really haven't been quite the same. But these are not always very easy to diagnose. And I'm sure, as everybody knows, these are very kind of vague symptoms, and they could represent anything. This could be, a low thyroid. This could be, feeling depressed or down or lack of exercise. So there's a lot of overlap with other diseases. And like I said, many patients, it takes them a while to get the right diagnosis. So that can be very frustrating. One of the ways that we help patients, if you know anybody who has asthma, they have an asthma action plan where they tell them, if this is how you're feeling, everything is okay. If the next thing happens, you're beginning to feel a little bit more short of breath, having a little bit more wheezing, increase your medications in this standardized way. And then if you start to have any of these other symptoms, you really need to go to the hospital and get treatment. So it's very similar for how we can manage our patients. And they usually need to check their weight daily to see if they're retaining fluid. They kind of keep an eye on if they're feeling swelling in their belly or their legs, and try to watch their salt intake and take all of their medications on time, which is incredibly important, and watch how much liquid they're drinking. This is often interesting, especially with my South Asian patients. They'll say, well, I have my 4 cups of chai a day, so does that count as fluid? And I said, yeah, that counts as fluid. Or I'm having rasam or sambar. Yes, that all counts as fluid. This is all adding up to your total fluid intake for the day. When we start to tell patients to use caution or contact our office, and this is why a heart failure cardiologist can be so helpful, is because as soon as you tell me you're gaining 3 or 4 pounds, you're getting a little bit more short of breath, I can adjust your medications over the phone or over our online system and tell people you really need to take more water pills. If we get this fluid off of you quickly, you won't end up in the hospital. But this third category, this red category, once you get to a certain point of retaining fluid, all of the water pills I give you by mouth aren't going to work. Nothing is going to be absorbed by your stomach because the lining is so swollen. Then you need IV medications, you need injections, and you need to come to the hospital. And often people are there for 4 or 5 days at least. And every trip to the hospital can make people much more weak. It really takes a lot out of their quality of life. And each trip to the hospital means that, you will have more down the line. So it's really a very big deal to try to avoid going to the hospital. And so what my team does, that's the most important, is help in that middle range and try to prevent these trips to the hospital. So there's multiple stages of heart failure, and they can be referred to with letters, they can be referred to with numbers, but basically, stage 1 is I can do most things. I don't have symptoms for the most part. They only come in very extreme situations. The second stage is really, I'm okay when I'm resting. There's no problem there. If I go up the stairs too quickly, then I notice that I have some shortness of breath. But for the most part, it doesn't bother me. It doesn't limit me. Stage 3 is when even going to the bathroom, going to the kitchen, trying to do, your bath, getting dressed, people are starting to get more shortness of breath. And by stage 4, which is what we consider, very severe heart failure and where we really should be doing other treatments, is when people, even at rest, they're feeling short of breath. And this is a very, very debilitating symptom. When you're always short of breath, you can't even walk 5 feet, 10 feet. And you can imagine that this really impacts people's quality of life. Feeling short of breath all the time and feeling scared when they go to sleep that they won't be able to breathe. So, kind of stage 3 and 4 is where we do a lot of really intense work to try to help people. So there's a lot of different scenarios in which you work with the medical system as a patient who has heart failure. There is this patient at home who we hope to keep everybody at home, especially our little aunties and uncles who are getting older. We want them to not have to come to the hospital, especially right now. No family can come visit you during COVID. Nobody there is speaking Hindi. You have to get an interpreter. It's a very stressful situation to go to the hospital right now. So if they can monitor themselves at home and send messages to the nurses or PAs or some sort of intermittent provider in the middle, then we can really try to continue communicating with them in between. Then you go to see your outpatient doctor, or sometimes you do telehealth now. We're doing more and more telehealth. A lot of my patients, especially in Chicago, during the winter, I don't want them walking around. It's dangerous, it's icy. So I'm very excited that some of these patients can get telehealth care more consistently now, because it's very dangerous for them to get out and about or be exposed to COVID. When you come to the hospital, there is usually a hospitalist team that will take care of you, and then hopefully a cardiologist or even a heart failure cardiologist who can be involved and really try to coordinate things so that when you go back home, we get you all of your medications, you understand why you're taking all of them, how to take all of them, and why it's so important to have a scale at home, maybe to have a blood pressure cuff, and to have somebody who's watching where you put the salt shaker. I saw a patient yesterday who is in her 80s, and her caregiver and her best friend try to help care for her. And they were arguing about, well, we need to put the salt away. She shouldn't even have it in the room. And when she doesn't have it in the room, she does fine. But, oh, you put it by the bedside. So now, that's why she's doing so poorly. So even some of these very little things and having other people involved in your care make a huge difference. And I always tell them that I love salt. So I don't really understand how to get away with not eating any salt, but that's what I have to tell them all to do. So this schematic just kind of really shows you how complicated it can get and how many different doctors you might be seeing. It can get really very confusing and overwhelming for patients. So, do I go to the emergency room? Am I going to be admitted to the hospital? Am I going to come and see my primary care doctor? Do I see my heart failure doctor? Do I see a cardiologist? And if everybody is trying to manage these medications differently, then we can get into real trouble and have difficulty and confusion. So, at least for myself as a heart failure doctor, I pretty much tell them for these particular medications, I'm the only one who is going to be adjusting them, or somebody from my team. Don't listen to anybody else, or give us a call before you make any changes, because often somebody will, intentionally, with very good intentions, say, oh, I don't think you need this medication. I don't think you need that medication. And then we have somebody back in the hospital before you know it. So we kind of become a little bit of a primary care provider too. Because our goal is really keeping people out of the hospital. We work pretty closely with people's primary care clinics and with their general cardiologists. We try to maintain a good relationship with them. And I actually have quite a few nephrology or kidney doctors that I work closely with, because many of our patients have kidney problems. And then a lot of the pulmonary doctors that we work closely with. So when you start to develop really good relationships and you share patients, you can have really good communication, and everybody does a little bit better. So one of the things that we have to think about as heart failure doctors, or doctors in general, is yes, we want you to survive as long as possible. That is definitely one part of the goal, but we also want to make sure that you have a good quality of life. So for some of my patients, if they're in and out of the hospital every single month and almost living there, then that is not necessarily a good quality of life. That is not how they want to spend their time. So, we have to figure out if there's a way to achieve all of these goals in a way that makes, this person happy. For some of my patients, what's most important is I want to see my grandkids. I want to play with them. So if I'm in the hospital all the time, I can't do that. So that's not useful to me. Or it's very important that I'm still able to cook for my family. I still want to be able to cook. I don't have to leave the house. I don't have to do the grocery shopping, but I want to be able to contribute in that way. So finding out which each person really cares about and what makes their day really good. I have to, go on my daily walk. That's the most important thing. Or I need to go to temple. I need to engage with my community. That's what matters the most to me. Then that's what we try to aim for, and really helps us focus on what treatments make sense for anybody. And then many people, I think especially in our community, a lot of it is, I don't want to be a burden. I don't want to be a burden to my children. I don't want to be a burden to my caregiver. I don't want them to be spending too much money on my care. And for a lot of people, this is so important that we do take this into consideration. And I might even, sometimes tell people, well, if you don't want to be a burden on your family, then you're going to do these things so that you don't go into the hospital and you don't stress them out. And sometimes that's the only thing that really convinces people that, like, okay, you're right, that I don't want to stress them out, so then I'll do what you're saying. So how do we manage heart failure? What are our options? So I think, and I tend to be on the more conservative side with my management of patients. I'm really focusing on the easy, simple things to do first. And if we need to go to the extreme things, we will. But I really want to make sure everybody's trying really hard to do the easy things. And that includes making changes in your lifestyle, including your diet, how much fluids you're drinking, are you taking your medications, and are you being active and exercising? We'll talk a little bit more about a monitored cardiac rehab program, which is one of the most effective ways to get people exercising even when they have a heart problem, because it's in a monitored environment. And we watch their heart rate, their blood pressure, and we educate them about nutrition and depression and all the medications that they're taking at the same time. So cardiac rehab can be a really, really big, important intervention. It's not, the insurance companies don't pay that well, which is very frustrating because really I think everybody with any kind of a cardiac problem should be able to participate in cardiac rehab. So it's something that some gyms will allow you to pay for, and you can just do it out of pocket at a very low rate because they've recognized how important this is. One of the kind of bigger interventions that we have are different implanted devices. There's a whole range of these now. They're implanted valves, they're implanted pumps, they're implanted, I'll show a little bit, but there's a whole system that decreases your sympathetic response, nervous system response that's implanted. And then there's even major surgeries, things like a surgically implanted heart pump, so a mechanical circulatory device, or a heart transplant, or surgical valve replacement. So these are all kind of on the spectrum of things that you can do. And some of them are right for some people. Not everything is right for everybody. So it's really good to think about, I know I have all these options, but what makes sense for me and for my family? The American Heart Association website has a lot of educational material, and I think it's really helpful because a lot of patients come to the doctor and they're not sure what questions to ask. One of the more common things is just, one, am I going to have a heart attack? And two, am I going to die? And it's very scary to hear this new diagnosis. I have heart failure. But I think that this is really nice because it makes you pay attention. How serious a problem is this? Just because you have heart failure does not actually mean it's a severe problem or that it's going to be a major impact on your life. What ways does having heart failure increase my health risk? So this is pretty important. What other things do I need to be worrying about, and what can I do so that my heart failure isn't a bigger problem? And, how can these lifestyle changes be incorporated? Is cardiac rehab an option? And what tests do I need? So often, when you meet a cardiologist, especially, you're often getting a lot of tests. And if you're seeing a heart failure cardiologist, you're probably getting a lot of tests, definitely in the beginning, and starting a new so many new medications. And I often have people who say, doctor, all I do is eat medications all day long. And I know it can be really hard, but each of them has a purpose, and they are actually very important and do help quite a bit. We have a cardiac pharmacist referral system, and they'll go over every single medication and the purpose and the correct way to take it and put them into pill boxes, because once people know why they're taking something and what the benefit is, they're much more likely to take it. But that can take 1 or 2 hours just to go through the medications of one patient. So these are the kinds of things that really make a difference. What can I expect in the coming weeks, months, or years? Everybody wants to know what's in the future. I often have to tell them, I don't know. None of us know. Everybody responds to any disease differently, but we will be watching you very closely. We're always here. Call us if you have any problems in between, and we will try to make adjustments so that you know that there's somebody watching out for you. So cardiac rehab, as I mentioned a little bit earlier, really just a great program. And I hope that once COVID is over and things are more safe, they'll be able to figure out how to get people back to exercising in this way. And there are a couple of private programs, like I mentioned. We have one in one of our suburbs where an exercise physiologist went out on his own and created his own cardiac rehab that's really, really well attended. Exercise is not just exercise. Exercise actually has to be done in a particular way and with an exercise prescription in order for it to be done in the most effective way to help your heart. So we have certain tests that we do to find out somebody's cardiac fitness. It's called a cardiopulmonary exercise test. And I can tell you, your heart rate needs to be between this and this range for 20 to 30 minutes, 5 to 7 days a week. And if you're just taking a leisurely walk 2 or 3 miles a day, but it's very leisurely, that's not necessarily going to improve your cardiac fitness. We really do need to be increasing how difficult your exercises are. You need to keep just making it slightly more difficult over time. Otherwise, you won't be getting the same benefit. And even the length of time that you're walking or the pace with which you're walking, or maybe adding an incline, those are the ways that you can really increase your cardiac fitness over time. One of the newer ways that we help manage patients is this little device. It's about the size of a dime. There's a little picture of it up there on the right side. It's called a CardioMEMS device, and it sits in the pulmonary artery in the lungs. And you have a pillow that at your house that you lay down on the pillow each day, and it sends an electronic reading to a website that my nurses look at least 3 or 4 times a week. And it actually measures the pressure of fluid in your heart before you start to have symptoms. For some patients who are maybe not as good about watching their weight each day or making sure that they're eating right, this little monitor can tell us, hey, we need to watch out. This person is getting into a danger zone. And we can communicate with them, call them, send them an email saying, your pressures are getting very high. You really need to increase your medications before you end up in the hospital. I have a patient who every Sunday after he watches football with his friends and goes to the bar and, eats French fries and all these things, every Monday we have these huge increases in his pressures. And my nurses now call him every Monday, like, oh, okay, you were watching football last night. Okay, take 2 extra pills and we'll be in touch with you tomorrow to see what your pressure is. So maybe sometimes they, take a little bit of an advantage of things, but this has really helped keep some people out of the hospital as well. And it's a really kind of on the newer side for technology, and really improves quality of life and reduces readmissions for some people almost by 50%. One of the newest things that was just approved, and my organization participated in some of the research studies, is something that looks almost like a pacemaker, but has a little tiny kind of electrical pulse sensor that gets put on the carotid artery. And it just sends a little electrical signal that says your whole stress system needs to calm down. And so it's an implantable device. And one of the issues with heart failure is that your body is overreacting to everything. So your stress response just keeps going up and up. And that's what most of the medications are treating, is our hormonal stress response. So this is one of the newer technologies. We've had a few patients who have done incredibly well with this. And it's a relatively minor procedure compared to some of the other options. So it's just a really exciting new area. So there's so many clinical trials. Like, heart failure is a very exciting place right now, because for people who are in the severe area, there's trials for everything. There's new medications coming out. 2 new medications within the last 10 years that have actually shown can prevent people from needing a heart transplant down the road. Like I said, this Barostim device, there are IV infusions you can get at an outpatient clinic to prevent you from going into the hospital to get IV medications. There are new therapies that can be delivered in the cath lab instead of having open heart surgery. There are still these other options, such as mechanical support and transplant, but this whole area is just expanding and expanding every year. And it's exciting to have more to offer people than we did, which was, not that long ago, was very little. So I won't get too much into this, but there are multiple different heart pumps that are surgically implanted. And my center right now has both of these two, but it's not the most recent one is even smaller than these two. The one on top is probably about this big is the pump part of it, but the battery packs are quite large. So people actually have a line that comes out of their belly and connects to a battery pack. And that machine is taking over circulation for the weak heart. The one on the bottom is a slightly smaller one that kind of fits right into the base of your hand. So much, much smaller, can be put into people who are smaller. More women can get this pump because they have a little bit more space. And then the newest one, I think, is even smaller than that. So this technology is advancing really quickly, and it is, scary to consider getting a mechanically implanted heart pump. But one of my patients is this uncle who he had this massive heart attack. His heart stopped 3 or 4 times in the span of 2 weeks, and he was in the ICU. He's an engineer, and so we showed him the pictures and we explained kind of what the pump does. And he said, okay, sounds good. He asked like so many really incredibly intelligent questions. And it actually, turns out he knows my family. So that was kind of interesting. But he's, more than 1.5 years later, doing incredibly well with his mechanical heart pump. He's actually taking care of his wife, who is 10 years younger, but has many more medical problems. So he's so active that I actually have to tell him, you really should not be riding your bike this much. It's like irritating the skin too much. Like, can you try to do walking, or can you try to just be a little bit less active, because you're just, he's defying all the odds. So, it went over it. So in really rare situations, there are people who need heart transplants. This is usually people who are under the age of 70, generally speaking. I do have South Asian patients who we have transplanted. It is a very large undertaking. It requires a lot of time in the hospital, a lot of testing, a lot of doctor's visits. It's definitely not for everyone, but for people who need it and whose families are able to support them through it, you can see some people live with heart transplants for 20, 25 years if they're doing well, maybe even 30. And it's a little bit tricky because you are part of a large group of people who are all waiting to get a heart transplant, but knowing that we have the option, I think is really important. And, even if you think you yourself, like, oh, I don't need that, and I'm fine, it's okay. I've had a lot of patients that we have to convince, like, you're very young, you have no other medical problems, please, really, you need to look into this. This is an option for you. You don't have to choose it, but at least know your options. So a little bit more focused on South Asians. There's so much in the media. Where I was at UC San Francisco, they have the Masala study. There's also a South Asian Heart Association group down in Southern Bay Area that I'll talk about a little bit later. Within India itself, there's a lot of growing knowledge about heart disease. And you can see all of these media talking about heart disease. In general, a number that I learned quite a while ago that most people are surprised by, Indian women are at 2 times the risk of Caucasian women having a heart attack, and Indian men are 4 times the risk of a Caucasian man. So we already know that heart disease is the leading cause of death in the United States. So then if you kind of think about how much more likely South Asians are to have coronary disease, it's pretty frightening. And this is true in India as well, but even more true for Indians living outside of India in the diaspora, because of different diets, different exercise levels, and things like that. So there's a couple of recent articles that came out, including the Journal of American Cardiology Association. And, they said that one of the issues is the diabetes risks. So even when we are not overweight or obese, we have a much higher risk of diabetes. And then that also feeds this whole heart disease risk. And so many young people having heart attacks at a young age. I'm sure, we all know somebody who had a sudden heart attack, massive, at a relatively young age that everybody thought, oh, that's somebody who's very healthy. That's somebody who exercises every day and they eat very healthy and they, do all the right things. But for our, genetics, we're still at a very high risk. A lot of doctors don't actually talk about this or know as much about it, because it's not something that's very commonly discussed. So you, as a South Asian person, might need to be insistent in telling your doctors, I am worried about my cholesterol. I am worried about my risk of diabetes. Did you know that a lot of South Asians have diabetes even when they're not overweight? And a lot of people don't know this. So South Asia, they're saying approximately 25% of the world's population, but about 60% of the world's heart disease patients. That's an incredible statistic. And something that, I think we need to spread the word and let other people know that it's important to take care of ourselves and we can't do what everybody else does. And in India itself, cardiovascular disease is a huge mortality. Even though we think about other issues like cancer, tuberculosis, infectious diseases, things like that, really cardiovascular disease for men and women is still a huge contributor. I thought this was really interesting. I had always thought that I eat a lot of salt, but there are actual studies on salt intake across India. You can see the areas with kind of the darker colors. They're getting 12.9 to 14 grams of salt a day. The American Heart Association and American College of Cardiology recommend about 2.5 to 3 grams for heart patients. And I think most Americans are getting at least 5 to 8 grams a day. So, this is incredible, just how much salt we are taking in. And just a little bit, I know everybody's thinking about COVID-19 right now. And for me and my patients, this is a huge issue because we know people who have cardiac disease, people who have hypertension, people who have diabetes are at much higher risk when they do get COVID-19. So this is something that's coming up quite a bit lately. And I think it's a reason why we as South Asians need to be very, very careful about COVID-19. Hypertension and diabetes, like we said, so many South Asians with those problems, those are the ones with increased rates of mortality. There are things that I don't see quite as often in South Asians, maybe, chronic kidney disease, obstructive pulmonary disease, which is more related to smoking or long-term exposure to pollution. But, hypertension and diabetes, that is, our population. On the left, there's a picture of a young man who's in his late 30s, so about my age, and had a very, severe episode of the flu and is waiting for a heart transplant. So I know that some people think the flu is not maybe a big deal. We do see people with the flu who are acutely, critically very ill and do die, even though they're very young. And in India, they're using ECMO, or extracorporeal membrane oxygenation, for a few patients with COVID-19, usually younger patients. In the bigger hospitals, they're doing this very infrequently. My own hospital, I know we've had a couple, we're only using it in very, very select cases. 2 people in their 30s out of 3 people in their 30s who were put on it lived, but both of them were in the ICU for 4 to 6 weeks at least on this huge level of life support. So it's still very, very scary. And, young people are getting very sick as well. ECMO, you're basically on cardiopulmonary bypass essentially. And this machine is taking over a lot of what your body usually does. So it's pretty scary. The different reasons, we're also seeing a lot of people who have had COVID now have cardiac disease, even if they didn't have it before, because you can get inflammation of the heart muscle. In a study in Germany, about 50% of people who had COVID-19 and only mild to moderate symptoms were found to have inflammation of the heart muscle if they all had cardiac MRIs done, which is just so frightening. We don't know what the implications will be long-term. I'm seeing a few 19-year-olds who had COVID with minimal symptoms, but have inflammation of the heart muscle. They're not able to exercise normally. They get pounding in their chest. They get short of breath. This is even 4, maybe 5 months after they had COVID. So there's still a lot that we don't know. Of course, lots of blood clots that we're seeing. And, all of these are things that are happening even in people who didn't have severe episodes of COVID. So I think there are just going to be a lot of side effects later down the road that we find out more and more about. So it's not something to be taken lightly. So what can we do? All of this sounds pretty disturbing and concerning. One thing that I think is the most important is really going to be our diet. I know that in general, most South Asians would say, I have a really, really healthy diet and I'm vegetarian and I eat so many vegetables. But really at least half of your plate should be vegetables. And ideally, some of them are raw. Cooking all of our vegetables with oil and adding salt, that's not, at least at this point in time, what nutrition is saying we need the most of. Some cooked veggies are fine, but it's really fresh veggies for at least, and fruits for half of your plate. And then just a little bit of anything with protein, like your lentils and whatever else you're eating, and some grains. So, a lot of rice, a lot of chapati, even these, a lot of these lentils will have carbohydrates as well. So just because you're eating, lentils or you're eating like vegetables, we really need to be focused on eating the healthier type of vegetables and really doing a lot more of the salad in addition to like the sabji. Sleep is incredibly important. Exercise, stress management with meditation. So the South Asian Heart Center, which like I said, is located in the Bay Area, they have a whole program that you can sign up for people who are interested that kind of helps you manage your lifestyle, and it's focused on South Asian people. So it's kind of a neat idea, but they talk about stress management. They talk about modifying your schedules and things like that can be really important. Actually being involved in a faith-based community or in a temple or anything like that is a huge reduction in stress, and it has been found to be related to much better health in general. So any kind of community that you're participating in is really important. And then here's what I was mentioning about the fluid intake, including your coffee or tea, and then somebody will tell me, oh, well, Heptira every afternoon or whatever. And, that's loaded with salt. That is pure salt. And even a little bit of it, you're probably getting your whole day's worth of salt. So sometimes even these little snacks that we're used to eating when we have our chai in the afternoon or something, they are not as healthy as we seem to think that they are. And then once again, kind of starting to read labels, looking at any kinds of prepared foods that have a lot of salt. Taking the salt shaker away, putting it away, trying to use more lemon, trying to use more masala, things like that to make food taste better. A little bit of salt is fine. And I've told some of my older patients, like, you're 90, I'm not going to tell you not to eat salt. You can eat salt if you want to, like, you do whatever you want, but I might need to give you more water pills, and then that has to be okay. You can do one or the other. So, it's all about compromising and figuring out what makes the most sense for you. So Atul Gawande, in his recent book, Being Mortal, kind of proposed a 5-question framework that I think is good for people to take to their doctor or think about before they go to the doctor. What is your understanding of your illness and where you are right now? So for some people, I'll ask them, why are you here to see the heart failure doctor today? And they'll say, I have no idea. I didn't know I had heart failure. So that's where we try to start, is this is why you're seeing me. This is what we're hoping to accomplish and achieve. What do you know about heart failure? What are your fears or worries for the future? And what are your priorities? If you don't know what your priorities are, then it's really hard to know if we can achieve them. For some people, that might be a special occasion. I have a wedding coming up in December that I want to attend. I just want to stay alive and be out of the hospital so I can attend this wedding. Like, okay, well, let's try everything we can to get you to, this family event. Whatever it might be. I want to go back to India one last time, or I want to go see my family abroad one last time. Those are very important things. And to me, sometimes that's more important than just making sure I'm treating your disease. If you really want to go back and see your family one more time, and this has come up with some of my patients, then we need to figure out a way to make that happen. What outcomes are unacceptable to you, and what are you willing to sacrifice? So if you're not able to walk, is that still okay? I think most of us will say, we don't want that. Nobody wants that. But if you have to give up one thing for something else, what kind of choices are you going to make, and what is worth it and what is not? I'm willing to live in a nursing facility forever as long as I can still talk to people, or I don't care what happens, I never want to move out of my house. These are the kinds of discussions that we have pretty frequently. And it's really good if people have already kind of thought about it. And what does a good day look like? And, if I can watch my, soap operas or whatever on TV, or I watch my, Hindi news, is that enough? Or I talk on, Zoom with my family members, maybe that's good enough. Or maybe it's, I want to be able to travel. I want to be able to see other countries. Maybe that's how good my day has to be in order for me to think it's worth living. So those are some of the things that I get to talk about with people every single day. And once again, I brought up kind of this workbook in the American Heart Association, like, what are the important things? What can I do? And what do I want? What am I looking for in my life? So in summary, we need to take pre-diabetes seriously. We need to take cholesterol seriously, and ask your doctor if he or she knows about rates of heart disease in Indians, because many of them are not aware, and not because they don't care, but because they just don't know. Watch how much fluid you drink and how much salt you eat if you have heart failure. These are very minor things that you can do to make your life better. Stay active. Think about what matters to you. Talk about things before you're sick. When you are acutely ill or just had a huge heart attack, it's not a great time to sit down and say, okay, well, what would this person have wanted me to do? It's important for us to know beforehand, before you get sick. Every couple of years, you keep talking about, well, I have a really good quality of life, or, I can't go anywhere. I can't do anything right now. If God takes me right now, I'm okay with that. And many people do feel that way, and are ready, actually asking me, why hasn't God taken me? And I say, I don't really know, but as long as you're here, we'll try to make it as pleasant as it can be. And then heart failure is not the end. There's so many new options. There's so many new things we can do. And you can still live a very fulfilling and meaningful life. And thanks for listening. As they mentioned earlier, I do live and work in Chicago right now. And many people think I'm crazy because it does get very, very cold, but it's a really beautiful city. These are just a few of the pictures of the skyline, and it's a great city. And I'm really happy to be somewhere where it's green and where there is water, because I did not grow up with that. And I love being near the water. It's beautiful. So I am open for questions if there are any.
Okay, thank you, Charuji, for a wonderful session. I just wanted to, share some information about our JKYog Academy. JKYog Academy has free online sessions, more than 4 to 5 online sessions on a daily basis. So, and those are all free, and you can see the link on jkyog.org, and online sessions. So, whoever will be interested would be, would go and register over there. You can even join our WhatsApp group as well. So where we share the schedule for a day, how many numbers of sessions we have. We usually have Bhagavad Gita, meditation. We start our day with yoga session and meditation and also just about that. And then I also want to tell our viewers that they need to, subscribe to our YouTube channel. So we usually publish, not publish, but at least we put our videos online, so they will get the notification. Okay, so thank you very much. Now let's ask the questions. I've got one question, an important question I got. Someone has a diagnosed with SVT. Can that cause heart failure?
Yes. So, yes. So anytime you have SVT or a different rhythm abnormality, basically your heart can be beating double or triple the number of times it needs to for many hours or many days. That takes a toll of the heart and can make it very weak. However, if you get rid of that abnormal rhythm, or if you slow down the heart rate, and if you take the right medications, you can often get the heart function back to normal. So it's what we consider a reversible cause of heart issues, because there are a lot of different treatments for a fast heart rhythm or an irregular heart rhythm these days.
Okay, thank you. So yeah, thank you very much. Another question. I mean, I personally thought of asking. Right, you mentioned about systolic. That's when the heart is weak, and diastolic when the heart is stiff. Are there different exercises or the lifestyle changes we need to make according to where we are?
So the systolic heart failure, or the weak heart, or the reduced heart function, that one is usually more related to either like some sort of toxin, maybe chemotherapy has caused that, coronary artery disease. So you're going to be managing your heart disease very closely. And that one has a lot more medications that can be used. The diastolic heart failure, or kind of what we call preserved heart function or stiffness of the heart. Unfortunately, we don't have as many ways to manage that right now. So it's usually more lifestyle modifications for that one. It's managing your diabetes, managing your blood pressure, sleep apnea if you have it, or being tested, being more active. Everything like that is what helps with the diastolic heart failure. So the two different problems are managed very differently. And we do hope that we can get more treatments for this diastolic or stiff heart.
Okay, thank you for that. Okay, another question I had was like are there any precautions that we need to take when someone is diuretics and maybe I'm not pronouncing right, diagnosing?
I'm sorry?
Are there any precautions to be taken when someone is diuretics?
With diuretics, yes. So your kidneys can actually have problems if you are on too much or too little diuretic, both. So that's why if my patients, I tell them to notify me for 5 pounds of weight change. So before they get too dehydrated or before they get too much fluid buildup, both of those times they should be contacting us. We do check your kidney function pretty frequently. We check your potassium levels. So as long as you're communicating with your doctor and your medications are stable, it's not as big a problem. In the beginning, when I'm starting a lot of medications, I check labs very, very frequently and make sure that people aren't eating too much potassium. This is a huge problem, I think, with my South Asian patients too. Too much potatoes all the time and things like that. So high potassium levels can actually be a problem. So things like that, just be in touch with your doctor and get your labs done when you're supposed to.
Okay, all right, thank you. And then another question I had, can other disease like high blood pressure, does it lead to heart failure?
Yeah. Often just age, especially like women as they're aging. It's very common to get diastolic heart failure or the stiff heart, just women who are aging. So that is one problem we deal with. High blood pressure alone can lead to diastolic heart failure. Pre-diabetes even can result in this. So as I mentioned before, heart failure is kind of encompasses every possible medical problem you have. Kind of eventually you might have some degree of heart failure, even if it's very mild. And it's just fluid retention and gives you these same symptoms. But sleep apnea, diabetes, high blood pressure, obesity, all of them can potentially lead to heart failure.
Okay, all right. Prem Gupta has a question. When should someone, do you want to ask question right now? Then we can unmute him.
I can read it.
Oh, okay. Yeah, sure. Go ahead.
When should somebody ask their doctor to send them to a heart failure specialist? I like this one. So there's a lot of different opinions on this. I'm a little bit biased, of course, but I think if you've had more than one hospital admission for heart failure, one or two, when should somebody ask their doctor? You can possibly get some benefit from meeting a heart failure specialist. Because we focus so much on different opinions on readmissions, that's not something that all cardiologists are able to focus on. We are focusing on a much smaller group of patients, and we're communicating with them really frequently. So if you're having any hospitalizations or having trouble managing things, at least a consult with a heart failure specialist might be worthwhile. A lot of people think heart failure specialist is only needed when you want a transplant or when you need a mechanical device, but I think that we think of health just slightly differently, and we're a little bit more holistic in our approach, including lifestyle and different therapies, and so I think if you are having any admissions to the hospital, consider a consultation.
Okay, thank you. Lina Ji has a question. Lina Ji, you want to go ahead?
Oh, you're still on mute.
I just wanted to ask you, like, if somebody, like some young patient, they get the viral cardiomyopathy secondary to some, not COVID, but some other kind of a viral infection, and they get into congestive failure, what are the chances of full recovery?
So it depends. There's a couple of different types of viral myocarditis or inflammation of the heart muscle. There are certain types where you just support them with mechanical support for maybe a week or two, and then they'll turn around. There's one or two types where they actually will need an emergent heart transplant evaluation. So it depends on making the diagnosis right in the beginning very quickly, and knowing which of these two types it is. So a lot of people, they'll go on to live full, healthy lives and just are on medication, no problems later. And then there are some people who need emergent heart transplant evaluations, and we do see some of those. For some women, after they give birth is a big time that we find out that they have some sort of cardiac disease or heart failure. So the stress of being pregnant actually, and all the additional circulation, and leads to them getting volume overloaded. And even if they had some degree of heart problems before, nobody knew it because their body wasn't under stress. I've also seen some people with severe heart problems after giving birth, that some that get better very quickly and some that don't get better. And it's, you at that point, you just want to be sure that you're at a medical center that knows how to treat that and deal with it. And if you need to be flown, or if your family member needs to be flown to a different city, to a different medical center, then that's what you have to do.
Okay. Do we have time? Can I ask you just one more question? Okay. Someone has asked, what are the 3 most important things my family and I can do to manage this condition?
So I think the most important thing to begin with is to get a diagnosis. So if you're not seeing your doctor regularly, if you're not getting your risk for diabetes checked, if you're not getting your blood pressure checked, then you'll never find out that you are at risk. And then how can you change anything later. So that's kind of the first thing, I think. See your general physician regularly. There is a really big purpose in seeing your primary care doctor, and they do a lot of very important things. The second thing is paying attention to your body, not just writing off like, oh, I'm a little older. This is just how things are. I have some patients who will say, oh, well, I'm 60, I should feel this bad. So 60 is very young. 60 is not old. So, we can't just write off these symptoms. There's actually something going on, and you need to bring it to somebody's attention. Otherwise, we can't help. I think the third thing is, like I said, the lifestyle, the diet, the exercise, and stress management. There's so much more research lately on amount of stress and how that affects your risk of having heart disease. We think that it's not something that we can change, but we have to, for our own sake and for our family's sake, try to manage it as best we can and try to make changes in our lifestyle if we are able to.
Right. Okay. Thank you. Thank you very much. I also wanted to, tell our viewers that for next Friday, 2 weeks, 2 Fridays, we will not be having health webinar because of Navratri, celebrations, it lasts for 10 days or so. So we will be missing that, and we'll join the other ones. And another thing is our video will be coming on the YouTube on Sunday. Okay, so we'll all watch on Sunday. And another thing I wanted to say about mind management challenge that Swamiji has been talking about. He has issued 21 videos. So every week we have 3 videos, like Monday, Wednesday, and Friday. So do watch that on the YouTube channel on Swami Mukundandaji, and then that's about it from us. Thank you very much. It was very, very informative, and I think all of us as being Asian and Indians, we need to really take into this. I think I'm going to watch this again and digest it, it's really, really useful, because sometimes we usually don't go to the doctors and say, no, it's okay. This is what we do. We do home medicine, home remedies. We try and do that as well. So, okay, thank you very much. And thank you very much, Dr. Cardiology. Radhe Radhe, Radhe Radhe, everyone. Radhe Radhe, Lina ji, everyone.